This is our PowerPoint on prostate problems by Alex Heitz and Andres Gijon. We are going to talk about the basic prostate problems, such as the benign prostatic hyperplasia, acute bacterial prostatitis, chronic bacterial prostatitis, chronic prostatitis, and prostate cancer. To start off, we are going to talk about benign prostatic hyperplasia, also known as BPH. It is a condition in men in which the prostate gland is enlarged and not cancerous. As the prostate enlarges, the prostate gland presses against the urethra. The bladder wall becomes more thicker, and then eventually the bladder may weaken and lose the ability to empty completely, leaving some urine in the bladder. BPH is most common in men over 50. It affects 50% of men over the age of 50 and 90% of men over 80. BPH is most likely to occur in men over the age of 40 who have medical conditions like obesity, heart disease, and type 2 diabetes. And this is a picture of BPH. Okay, next is acute bacterial prostatitis. Acute bacterial prostatitis is a severe bacterial infection in the prostate gland. It is usually caused by the same bacteria that results in a urinary tract infection. Symptoms include chills, fever, pelvic pain, painful urination, painful ejaculation, and blood in the urine. People are at risk if they have a UTI, which is a urinary tract infection, have an STD, have psychological stress, and or dehydration. Chronic bacterial prostatitis. Chronic bacterial prostatitis is a rare condition that causes recurring infections in the prostate and results in swelling, inflammation, and frequent urinary tract infections. Most causes of this disease is any kind of bacteria that causes a urinary tract infection or a sexual transmitted infection, such as chlamydia and gonorrhea. What can affect chronic bacterial prostatitis in men is an enlarged prostate, an infection in or around the testicles, and urethral structure. About 7% of people with chronic prostatitis have chronic bacterial prostatitis, which leads us to chronic prostatitis. Prostatitis means that you have inflammation of your prostate gland. It can be infective or non-infective. 3 out of 20 people eventually get chronic prostatitis at some point in their life. Chronic prostatitis is most effective in men between the ages of 30 through 50. Some symptoms that might show in chronic prostatitis is pain in or around the penis, anus, or abdomen, a pure urinary system, sexual problems, nausea, and general aches and pains. Some possible treatments for chronic prostatitis is antibiotics, alpha blockers, some medicines, and even stress management. Prostate cancer is a cancer that is found in the prostate gland. It is only found in men, and that is why at the age of 45, men start getting prostate exams. Common symptoms include painful urination, weak urinary system, dribbling of urine, frequent urination, difficult starting and maintaining a steady stream of urine, and excessive urination at night. Symptoms include chemotherapy or an injection. Test question number 1. Is benign prostatic hyperplasia cancerous? I'll give you a few seconds to answer. The answer is no. Next question. What kind of tract infections can you be at risk of with acute bacterial prostatitis? I'll give you more time to answer this one. The answer is urinary tract infections. Next question. What percent of people that have chronic prostatitis have chronic bacterial prostatitis? I'll give you some more time. And the answer is 7%. Next question. True or false? Chronic prostatitis cannot be non-infective. I'll give you some time to answer. And the answer is false. Last question. What are the two main treatments for prostate cancer? And the answers are chemotherapy and or injections. And that is it. This will be our bibliography. Thank you for listening.